what I've got now is just 5 or 10 minutes on really putting arts and music in some kind of historical context in mental health. And so here we're going right back that to show that you know, music is part of our core basic humanity, and a very early thing. Probably we were musical before we even learned to speak in prehistory. And the earliest musical instrument is a 40,000-year-old flute. They're found in a German cave, only quite recently, in end of last century, fashioned from a vulture bone. And that flute plays a pentatonic scale. For those of you budding guitar players familiar with the pentatonic scale, 5 notes in scale. So that's what that bone flute is tuned to play. So really our caveman brains developed, as we know, to help us to be able to respond to threats and to survive and to gain food and more shelter. This is, you know, I think part of the story of why we have you know, the complex sort of mental health phenomena that we experience in modern life, because we're not really cut out for the kind of lives that we try and lead with a sort of chronic threats being present. And really, what our caveman brains, we're designed to deal with acute threats, like a tiger there jumping on the caveman. And if threats become chronic, then it sets up all kinds of problems in our brains and bodies. And so this is why this causes much distress. Music was really we you know, anthropologists believes was a early way to get people together and to help modulate emotions in the group and help groups become larger back in caveman time. So then moving forward, thinking about how we've got to where we are now, we're in the Enlightenment in the 1700s. Everything changed around, and the traditional religious beliefs were challenged, and art became very important, and there was the Romantic movement with the idea of the artist or the musician as somehow elevated and being special, so different to everybody else. So in some ways, I think you can say that you might say that this was part of art and music being handed over and sort of professionalized, and it might have been a bit of a loss to everyday music making. Is one way we could look at it. And you know, I think to some extent in the Victorian times, there were some efforts to bring back music for the people, and different guilds and so on, and arts for people to enjoy and be involved in. So there was a bit of a movement back the other way. Then thinking how art, music and culture, I mean, there on the right there, you see it, and I didn't know this until last year, reading about it, that the right to share in the benefits of my community's culture, arts and sciences is actually one of the articles of the Human Rights Declaration of 1948, and I really didn't know that. I think now it was Human Rights Day last week, wasn't it? And and why I think why it might have been so prominent, the arts culture in the Human Rights Act just after the war, was because one of the first things the Nazis went to try to take away from the Jews was the right to be involved in culture and to publish and to make music. And so, and they had this idea there, and there on the left there is a Nazi imagery, of Nazi racist imagery about Entata Musik, which is degenerate music, and they went to say that all jazz and other Jewish music were degenerate, and so and they banned it. So hence, I think after the war, why it was held to be an important thing. And I think this is important because people with longer term mental illness in our society are some of the most excluded people and don't really have the benefits of arts, culture and sciences that other people do. So I think it's a human, I come at this from a human rights perspective, really. It's a right for people to be involved and have these benefits. So going on then, after the war, during the war, there was a massive, in this country and probably abroad there as well, there was a massive use of arts to sort of bolster up the spirit and the war effort. And there were these bodies called ENSA and SEMA, which were the armed forces entertainment branches, and who entertained troops, and also SEMA did stuff around works and factories and so on, ballet and stuff like that for the workers. And after the war, with the creation of the welfare state and the NHS, the SEMA and ENSA were closed down, and the Arts Council started, with really this idea that the state would fund arts for the betterment of the people. And there you've got the first exhibition of the Arts Council, Van Gogh, which was at the Tate, Britain, in on the Thames there, and the South Bank there, I think the National Theatre there, or Festival Hall, I can't remember which, or Hayward Gallery, part of the South Bank complex, which was again part of that era. Now, what happened in mental hospitals after the war? You had, while there were early moves to close down hospitals, which the mental hospitals, which happened really, although we think of, as Vinny says, the 70s as an era of closure of hospitals, actually the number of hospital beds had started to go down since the mid-50s. And so there were experiments at community care and therapeutic communities and so on, going on, right through this period. And you had artists were part of the scene with the with pioneer artists and musicians coming into the mental hospitals, doing arts and music with the residents, patients there, and really being the foundation of arts and music therapy that we have today as therapies. And Edward Adamson was an artist who had studios in the North London Asylum there, and he was tremendous, just letting people to do art. And if you look at the Adamson collection, which is hosted by the Bethlehem and Maudsley It's all the art that his clients did, thousands of pieces, and these are tremendously moving. Some of them done, on very limited, just pieces of toilet paper as one of the examples. And Mary Priestley, who there was one of the pioneer early music therapists, and she again similarly working in the asylums. So those were pioneer musicians. Then coming on into the 60s, of course, everything changed then, with the movement with rock music, and a whole change of freedom and autonomy for young people, and the peace movement, and so on, the anti-war in Vietnam movement, and the first big music festivals there. There's Woodstock, one of the first music festivals ever, and you had, out of that period of creativity in the 1960s, you had musicians and artists who started really the practice of community art and music with groups in the community, sometimes for a specified reason, a sort of local political reason, or a need, and the practice of community arts and music really grew from the 1960s and has carried on through into what we now call arts participation, and which has become absorbed into the health service. So this is the other strand. You've got the musicians who earlier, developed therapies out of music and their experience with patients, and then you've got this other sort of strand, which is not therapy, but music and art for art's and music's sake, almost, although it might be for a purpose, but not therapy per se. And there on the right there, you have the report of the all-party parliamentary group on arts and the arts for health and well-being, and this was 3 years ago, and a big report summarizing a lot, which is worthwhile looking at. Here's a infographic from it, and I think this is useful actually. I want to give you just an idea of the sort of breadth of the topic. Here you've got bottom left, participatory arts programs, and this is a participatory arts for any group, and here we're thinking of health. So this might be for your lung problem, you have a choir, or for arthritis or something, you have a knitting group, something like that, or for mental health, you might have any kind of thing. Participatory arts programs. So you could say that Our Creative City project was a participatory arts programs. You've got arts in health and care above it, and so this was a movement bringing arts into the general hospitals. And I expect you students are familiar with seeing that around Liverpool. There'll be some quite good work being shown, and things, even some arts participation going on there. You've got the arts therapies that I mentioned. Now, arts on prescription there. This is this idea of arts on prescription. Social prescribing is the latest government idea, and the GP can direct their depressed patient off to say, well, how about you going to see a social prescribing link worker who can talk to you about what might be available for you, some kind of activity which will help help you recover. And so this is the idea of social prescribing. Then on the right, we've got everyday creativity and attendance at cultural venues and events. And this is this idea of you know, just what we do, not intentionally for health benefits perhaps, but just going to gigs, going to museums, and how this affects your health very positively. So there's a body of research and understanding about this, that is growing. And then we've got the built and the natural environments, and so you know, sort of stately homes and gardens and stuff like that, and parks and all that, and how that can contribute to our health. And there in the middle, you've got arts as part of our training in medicine and in healthcare, as being a way to contribute to our training and our CPD. And so Vinny's performing his stuff, you know, and music, and including the Silver Meadows stuff. It's a great, you know, fillip to my psychiatric colleagues at that conference that we had. So there, here are some, you know, references which about this evidence of from big data, and these are like longitudinal big cohort studies from this country and from Northern Europe, looking at cultural participation and well-being. And there's a lot of positive findings from that methodology there, which are fairly rigorous and published and peer-reviewed and so on. So there we are, lower odds of developing depression by a massive amount if you've taken up a hobby. And so that is, there's here we are, there are good practice examples, and coming back to arts participation and so on. And there are these examples of other projects and references and so on. And at the bottom there, there was the WHO commissioned a scoping report by Daisy Fancourt, who's a researcher in this area, and this was published last year, which tries to summarize the whole of the area and the evidence about it. And here are some resources. Well, there's Tonic's address, and other musical charities that are similar to Tonic in many ways. In London, there's Key Changes and Rhythmics in Hastings. So now here we are. This is a good quote, I think, by Richard Wilkinson, who was the author of The Spirit Level, who you might have come across, that work, which is about inequality and all the things that arise from social inequality, including poor health outcomes. And but his quote here really saying how music and musicians can contribute to public health through raising awareness and making us think about ourselves. And I think that's a very good quote. You'll recognize, I mean, musicians at the bottom who walk that walk and make us think about ourselves. On the right is Woody Guthrie, the sort of protest singer from America, who was a migrant in his own country after the Dust Bowl droughts of the 1930s, and wrote powerful songs. he's got on his guitar there, this machine kills fascists, which is you know, sort of extreme, but he's well known for that. He died of with Huntington's disease, actually. Then oh, here's you know, Tonic Choir in a performance and so on. Then of course we're health professionals, we can't go around saying we're going to kill fascists. So, you know, I think this quote here, "This machine mildly annoys fascists," is more appropriate for you know, health staff and so on. There we are. Okay, well, that's my